Welcome back to The Deep Dive, the show where we extract the crucial knowledge from complex research, giving you the detailed insight you need fast. Today, we are immersing ourselves in a topic that lives really at this fascinating intersection of, well, classical art, modern science, and clinical execution. We're dissecting the core principles of facial and dental aesthetics, exploring those powerful foundational rules of visual beauty, symmetry, proportion, balance, and analyzing exactly how these classical design principles translate directly into successful, predictable outcomes in dental work.
Yeah, and it's not just about, what looks good.
Right.
It's really about understanding the measurable architecture of beauty itself. It's like having a framework, for excellence.
A framework. I like that.
We're moving past just the subjective feeling, past simply saying, oh, that's an appealing smile, and really providing you, the listener, with the analytical tools to understand why it's appealing.
And how you can reproduce it.
Exactly. How you can consistently reproduce that result using these, centuries-old aesthetic laws, but fused with modern technology.
Okay, let's unpack this then. Start right at the foundation. Before we even talk about teeth specifically, we need to define the target, right? How do the sources define visual beauty? Just in the context of the human face.
Okay, so when we talk about visual beauty, we're defining it pretty strictly based on external perception, how things look.
Right, observable.
Yeah. The consensus definition really centers on achieving a state of high harmony and balance. So beauty is achieved when the observable features of the face, when they're perceived by someone looking at them, to be in a coordinated, harmonious, balanced state.
Harmony and balance. I mean, they sound a bit lofty, almost philosophical, but you're saying this is actually a measurable standard.
It is, yeah. Or at least that's the goal of the scientific approach. It's grounded in methodologies championed by influential figures in modern aesthetic design. Think people like Abar and Coachman.
Yeah, the NYU Smart Design work.
Exactly. They took these concepts, harmony, balance, and they really tried to limit them to what could be visually assessed, quantified.
Made practical.
Made practical, exactly, and manipulated in clinical practice, particularly looking across different facial planes, frontal view, profile view, oblique views.
So we're essentially saying that attraction,
Yeah.
it isn't just random. It can be analyzed, broken down.
That's the idea. It can be analyzed, measured, broken down into components. And when you start that initial aesthetic analysis, there are two absolute foundational rules that seem to govern whether something is perceived as beautiful.
Okay, what are they?
The sources are really clear on this. The two fundamental rules driving that initial attraction are symmetry and proportion.
Symmetry and proportion, the big two.
They're non-negotiable, really. If a face or even just a feature significantly lacks either symmetry, meaning, the left side mirrors the right, or correct proportion, meaning the relationship between the sizes of different parts feels right, harmonious.
Then the attraction drops off.
Significantly. The overall level of attraction perceived by the viewer just plummets. These two rule sets, they kind of establish the base requirement for what our minds register as aesthetically sound.
Okay, now here's where, for me, it's really interesting. The face has lots of features: eyes, nose, ears, lips, chin. But the research seems to suggest only two organs are primarily responsible for generating attraction.
That's right.
Which two are they? And maybe more importantly, why those two? Why do the others fall into a secondary category?
The primary organs generating that perceived attraction are the eyes and the lips and mouth area.
Eyes and mouth.
Yeah, the ears, the nose. While they're definitely crucial for the overall facial architecture, they're typically considered secondary in terms of attraction.
And the reason?
The reason boils down to one single vital concept: dynamism.
Dynamism,
Yeah.
movement.
Precisely. Unlike static features like the nose, which stays relatively fixed, right? Or the ears, which don't really move, the eyes and the mouth are constantly dynamic.
They're expressive.
Exactly. They're the primary tools for emotional expression, for communication, for interaction. When you're engaging with someone, your focus naturally gravitates towards these moving, expressive parts. That movement, that's the critical insight. It elevates them way above the static features.
That makes so much sense.
Yeah.
You can have a perfectly symmetrical nose, meeting all the classical rules, but it can't convey excitement or joy.
Or curiosity or sadness.
Right. It's the smile, the laugh, the eye contact, the movement that communicates personality and drives that connection.
But doesn't this dynamism also create a bit of a conflict in the literature, depending on who you read.
It does, yeah. You see a pretty clear distinction based on professional focus. If you read aesthetic texts by dental experts, they naturally emphasize the oral cavity.
Their area.
Right, the teeth, the lips, the surrounding soft tissues.
Yeah.
They see that as the most crucial component of beauty because it's central to the dynamic expression of the smile. For them, the mouth is key.
But conversely, you look at work by plastic surgeons, and they often place paramount emphasis on the eyes. They frequently cite that classic phrase, eyes are the window to the soul.
The dominant source of interpersonal attraction for them.
Exactly. So while both disciplines might argue for their specific area of focus, the ultimate takeaway for us, I think, is that both dynamic features are absolutely paramount.
And the design, the restoration, it has to honor the requirements of that movement.
Absolutely. Both are vital. But their capacity for dynamic, real-time expression is the core reason they generate significantly more attraction than static features. So whether you're focusing on perioral structures or periocular structures, movement is the master key.
Which forces practitioners to think beyond just the static photo, right? The before and after shot.
Totally. You have to consider how the restoration looks when the patient is actually speaking, laughing, or even just relaxing their face. It's got to work in motion.
That transition leads us really nicely into the required convergence in dental design. If the face provides the overall context, how do we connect the two pieces, the overall facial view and the specific dental work, to hit that full aesthetic goal? The sources mention two critical views, IC and Bentel. Can you define those for us?
Yeah, this is really about defining full aesthetic success. To achieve beauty in this field, you need a convergence, a meeting of two components. First, you need the macro-level analysis. That's what we call the IC view, or inspirational composition view.
Inspirational composition.
Okay, this refers to the overall beautiful face, the macro-level harmony, symmetry, proportion of the face itself. It sets the foundation, the context for the smile.
Got it. And the second component?
That's the Bentel view. This focuses on the micro level. The dental components themselves, the teeth, the gingival contour, the specific relationship between the upper and lower arches. This is the detail work.
So IC is the big picture. Bentel is the close-up.
Pretty much. And the convergence means, well, a perfect Bentel restoration, meaning technically flawless teeth, won't result in overall aesthetic success if the IC view, the face itself, lacks harmony.
And the reverse is true, too.
Exactly. A beautiful face can't really carry a flawed or discordant smile. Both have to be present, and crucially, they have to be harmonized together, working in context. That's what defines the achieved state of beauty.
Okay, that sets the stage perfectly for digging into the rules themselves. We've established beauty can be measurable. That's the objective side. But there's always been this tension, haven't there, between that objective, measurable beauty and what we call subjective beauty. Let's define that difference clearly.
Right. So subjective beauty, that's inherently philosophical. It's culturally driven. It's personal. It's heavily influenced by external factors like cultural norms.
Right.
We'll think about historical things like foot binding in some regions, or certain contemporary cultures valuing specific body modifications, or even just historical eras dictating fashion trends like powdered wigs or something.
Okay.
It also hinges on just personal mental pleasure and association, what you happen to find pleasing.
The classic beauty is in the eye of the beholder.
Exactly that. And the crucial factor here is that subjective beauty, well, you can't really measure it or quantify it scientifically. It's an internal standard or a cultural one, and it changes all the time across geography and history.
But in our field, in design, we have to rely on the opposite, right? Objective beauty.
That's right. Objective beauty, which is really the focus of psychology and classical aesthetics, posits that there are specific, universal, measurable rules that dictate harmony and beauty across human perception. This forms the sort of unshakable foundation of what we rely on, which is classical aesthetics.
And these objective rules, they aren't newfangled ideas. They're deeply rooted in history, going back to the Renaissance. Tell us a bit about that historical foundation.
Yeah, these classical definitions were really codified by the great minds of the Renaissance. Thinkers like Leonardo da Vinci, Michelangelo, the masters. They didn't invent beauty, of course, but they codified its mathematical rules. They studied hundreds of bodies, hundreds of faces, to try and determine the ideal relationships, the ideal proportions. The golden ratio is the most famous example, right? They were looking for the rules that govern how we perceive the idealized human form. They essentially turned art, well, into a kind of engineering.
And their principles distilled down to those three core classical aesthetic laws we mentioned at the start.
The big three. Symmetry, proportion, and balance, or equilibrium. These three rules are the absolute foundation. If you want a quick guide to analyzing any piece of classical art or design or architecture, you assess these three parameters first. They dictate the structural success of the visual outcome.
Okay, the rule is clear. Symmetry is ideal. But here's the major clinical conflict, the thing practitioners wrestle with every day. The source material talks about what's sometimes called the Swiss paradox, an observation from Swiss dentistry back in the 90s. Tell us about this contradiction regarding perfect symmetry.
Right, this is such a vital point because it really separates the technician from the true artist-clinician, the objective classical rules. They demand 100% symmetry. If the left side is a perfect mirror of the right, mathematically, it should be perfect.
Should be.
Should be. However, what these Swiss clinicians observed was that when they executed perfectly symmetrical restorations, meaning the teeth were perfectly matched in size, contour, position, everything, on both sides of the midline, the result often appeared too, well, artificial.
Too fake, unnatural.
Exactly, too fake, unnatural, despite being mathematically perfect by the rules.
But why? Why does perfection look fake? That seems like a contradiction.
It's because nature itself is inherently imperfect, or perhaps subtly asymmetrical. Our brains are incredibly adept at recognizing tiny deviations from absolute symmetry. So, when teeth are a flawless mathematical mirror image, the observer's brain immediately registers, maybe subconsciously, that this is manufactured, fabricated.
Because natural teeth always have slight differences.
Always. Due to wear, minor structural differences, developmental variations, natural teeth always possess slight natural asymmetries, tiny imperfections.
So following the objective rule perfectly creates an undesirable subjective outcome. The patient, or anyone looking, recognizes that perfection means fabrication, and fabrication means, well, lack of natural character.
Precisely, it creates this paradox. The rule dictates symmetry, but the pursuit of a natural, lifelike appearance demands controlled, subtle variation, a dose of calculated imperfection.
Calculated imperfection, I like that.
The true challenge, then, in modern design isn't just following the rule blindly, it's analyzing this contradiction and finding that sweet spot. We need to aim for visual symmetry and harmony overall, but achieve it through subtle asymmetries in things like texture, line angle, maybe slight variations in shape that mimic natural wear and growth.
That's a fascinating tightrope to walk. The perfect amount of imperfection. Which takes us beautifully into our next section, really. How do we integrate this artistic knowledge, this skill in managing imperfection, with modern technology? With the science part, let's start with a clear, functional definition of science in this clinical context.
Okay. Science, or maybe technology in this context, is really defined by its outcome. It's about using systematic study, based on knowledge, to achieve outcomes that are predictable and, crucially, reproducible.
Predictable and reproducible, keywords.
Absolutely. If you follow the systematic steps, use the specific knowledge base, you must be able to consistently replicate the result. That's the power and the definition of science here.
We see this clearly in things like materials engineering, right?
Precisely. If we're manufacturing, say, a full coverage crown, the material science, the CAD/CAM techniques, the systematic knowledge of how ceramics behave when processed, all that allows us to reproduce that unit consistently across different labs, different technicians. That's the science component, the ability to replicate the foundational form reliably.
But
As we've just established, simply reproducing a block of ceramic perfectly doesn't guarantee an aesthetic result, not by a long shot. That requires the application of art and skill.
which brings us neatly to art and the foundation of artistic principles. Let's look at that analogy referenced in the sources, this story about learning basic drawing, starting with just a simple cube. It's a great way to maybe demystify the idea of innate artistic talent.
Yeah, that analogy is essential because it shows how even the most complex aesthetic design really begins as an analytical process. When learning to draw, the very first step, even before you really start sketching, is proportion.
Getting the dimensions right.
Exactly. The instructor would demand that students use their pencil, hold it up as a measuring tool, physically measure the height versus the width of the object to determine the mathematical relationship between the parts before drawing them.
So the initial act isn't really drawing the cube, it's analyzing its dimensions, its measurement.
It's absolutely an analytical and mathematical process first. You're not drawing what your subjective eye thinks it sees. You're drawing what your objective analysis measures.
Okay, proportion first, then what?
Then, once proportion is established, the next crucial step is incorporating light and shadow. And this is where art meets physics.
physics. How so?
Well, since the light source in the studio was fixed, students had to constantly analyze the physics of that light hitting the cube. They had to identify 4 specific areas consistently.
Okay, what are the 4?
First, the brightest point, that's the direct hit from the light source. Second, the secondary light area. Third, the darkest point, the part of the object facing away from the light, the core shadow. And then fourth, the secondary shadow.
Secondary shadow.
Yeah.
What causes that? Is that different from the main shadow?
Yeah, it's often called reflected light. It's caused by light bouncing off the surrounding environment, maybe the table the cube is sitting on, the floor, the walls, and reflecting back onto the dark side of the object itself. So even the shadow isn't uniformly black. And if you understand the physical properties of light reflection, absorption, you can predict and understand where these highlights and shadows must fall logically, regardless of how complex the shape gets.
Wait, let me stop you there because this is a really powerful takeaway for our listeners, I think. You're saying the art instructor was correcting the students' proportion, their measurements, and their analysis of light physics, but not their actual drawing technique, their style.
Precisely. The only element the art teacher in that story explicitly refused to correct was the individual stroke style. You know, the unique pressure, the motion, the characteristic way someone makes marks with the pencil. That's the personal characteristic, the handwriting, or the artist's signature style.
But everything else was teachable.
Every other technical aspect, proportion, light, shadow, defining the form, was treated as a scientific rule. Correctable, teachable, measurable, not mysterious talent.
That is the core synthesis right there, isn't it? Aesthetic competence isn't about some nebulous innate gift. It's about mastering a set of scientific and analytical rules, and then applying your unique skill, your stroke style, to the execution.
It means we can teach people to achieve aesthetic success. It's learnable. If your initial proportion analysis is wrong, your final product will fail aesthetically, no matter how beautiful your individual strokes might be. Art, in this sense, is applied analysis and applied science.
Okay, let's apply that directly to dental design then. Clinicians often start with a preparation or maybe a wax-up that is necessarily a bit blocky, right? Sometimes described as a T-shape or a 4-sided block. How does this drawing analogy explain transforming that block into a rounded, natural tooth form?
Think about drawing something beautifully rounded, like that classical statue, the Venus de Milo. You don't start by drawing curves immediately. No, you start by drawing the rectangular block that basically encapsulates her form. You establish the proportion and the light analysis on that analytical 4-sided form first. Get the foundation right. Only once the science, the structure is correct, do you begin to, well, conceptually, smooth off the flat surfaces.
Rounding the corners, smoothing the planes to create the curved, natural, lifelike contour.
That's the artistry layered on top. And the sources confirm this concept applies directly in teaching tooth preparation design, for instance. You start with the analytical 4-sided block, maybe a T-shape, which ensures predictable strength and fit. That's the science.
Making sure it works mechanically.
Exactly. Then you apply the skill, the artistry, to contour, round, and smooth those flat surfaces until the result perfectly mimics natural tooth anatomy, managing the way light hits those curves and transitions. The final artistry relies entirely on the correctness of the initial scientific analysis of those block forms.
We've covered symmetry and proportion in detail. Now we need to address the final classical principle, balance or equilibrium, and its crucial connection to composition.
Right. Composition is absolutely essential in painting, photography, any visual design, really, because it's the way we ensure the visual image feels stable.
It's stable.
Meaning it doesn't look tilted or weighted too heavily on one side or just visually uncomfortable or unstable. It's about ensuring the visual center of gravity feels correct to the viewer.
Are there specific techniques used to manage that visual center of gravity?
Oh, definitely. One well-known method, used a lot in design and photography, is the triangle method. By visually placing key focal points, maybe the highest points of the canine teeth, or the central incisors within a stable triangle shape in the composition, you guide the viewer's eye and make sure the image feels grounded and stable, not like it's about to tip over.
So when we look at the oral cavity, at a smile, we have to view it not just as individual teeth, but as a complete picture, a composition.
Absolutely. The oral cavity is a composition, a picture. When designing prosthetics or restorations, the entire visual field has to achieve balance. The design needs to ensure that the aesthetic center of gravity is perceived as stable and centered within that frame.
And light plays into this too.
Hugely. Balance is affected by light and shade. An object, or a tooth in this case, that absorbs too much light or reflects too little can feel visually heavier compared to its neighbor, even if they're the same size. It can throw the whole composition off balance.
It really is the synthesis we've been building towards, the ability to achieve that final, beautiful result. It's fundamentally a composite system, isn't it?
It is. It's the science of beauty. The systematic study of those measurable rules like proportion, light physics, symmetry combined with an art. And the art requires the skill, the technique, the contouring ability to execute the design, to manage those subtle variations we talked about with the Swiss paradox, and achieve the final balanced aesthetic composition.
So if you can define the rules,
You can measure the failure, and you can systematically work towards achieving success. It demystifies it.
so wrapping this up, what does this all really mean for the clinician listening, or even for the curious patient who wants to be truly well-informed about dental aesthetics?
Well, we've established that achieving aesthetic excellence isn't some mysterious talent, right? It's not just for the gifted few. It's more like a robust framework of objective rules. Symmetry, proportion, balance, considering dynamism that requires specific, systematic skill to execute well. Understanding that scientific analysis of block forms, light reflection, dynamic movement allows for successful, predictable execution. It really is this marriage of the analytical and the technical.
And that understanding gives you, the listener, the power to assess, maybe even critique a design process effectively. If a result isn't quite successful, you can actually go back to the rules. Was the proportion off? Was the overall composition unbalanced?
Right.
Did we fail to account for dynamic movement properly?
But we have to return to that critical contradiction we discussed earlier, that need to manage controlled imperfection. We know perfect symmetry often looks artificial, yet the mathematical rules demand perfection. We know movement is crucial, requiring a restoration to low natural, even when it's stressed dynamically during speech or smiling. So this raises, I think, an essential question for you to consider. Something to mull over as you approach your next design challenge, whether it's clinical or just analytical. When you're faced with the demands of those mathematically perfect aesthetic rules and the simultaneous requirement to achieve the subtle, natural imperfections that grant lifelike appeal, what specific, perhaps measurable parameter, maybe one beyond the standard list we've discussed, do you choose to intentionally manipulate or adjust? How do you dial in that optimal amount of natural imperfection for an individual patient, making it theirs?
A question that definitely demands analysis, skill, and a deep understanding of the rules we've explored today. Thank you for joining me for the deep dive. Thank you for joining us for the deep dive. Goodbye. 1 second pause.